Hello, this is Group 5's Community Assessment presentation on fentanyl use in young adults by Amanda, Harpreet, Teresita, Jason, and me, Marge. What is fentanyl? Fentanyl is a synthetic opioid drug approved by the Drug Enforcement Administration in the treatment of pain relief and anesthetic purposes. Its potency is significantly higher than other opioids, about 100 times more potent than morphine and 50 times more potent than heroin, and can come in many different forms. Fentanyl was introduced in 1960 for use as an intravenous anesthetic. It wasn't until 2011 through 2018 when fatal overdoses started to emerge and increase each year. At the start of the COVID pandemic, a dramatic increase in drug overdose cases rose above 100,000 in 1 year. Of those overdoses, 64,000 cases were fentanyl-related. Fentanyl is trafficked into the U.S. by China and Mexico, with China being the primary source. It's then sold through the illegal U.S. drug market. According to the DEA, recent investigations have included India in the trafficking of fentanyl from China to Mexico. This map shows the fentanyl flow from China, India, and Mexico, eventually making its way into the U.S. The fentanyl crisis is a public health concern because it doesn't discriminate and can affect all populations such as young adults, adolescents, the elderly, the rich, and the poor.
So, according to the San Joaquin Public Health Services, in 2021, 48 people have died from fentanyl overdose in just San Joaquin County, and over half of the victims were 14 to 35 years old. The fentanyl overdose death rate in 2021 was 20 times higher than 2018. And this is according to the San Joaquin County Public Health Services. So for the California fentanyl statistics, according to the KFF, when comparing California to the other stats, it is among the highest in the ages of 25 to 34. Even if you look at the ages 0 to 24, it is still up in the high double digits. So California, if you look, is 12%. And if you look at Arizona, Arizona's 14%, but it is still among the highest when looking at the single digit states, and more likely in ages 25 to 34. So definitely in the young adults, it is affecting it very immensely. And if you look to the right, I have California quick statistics, and you can see that there's 6,954 deaths related to opioid overdose. And then if you look to the right, it shows you that there's 6,095 deaths related to fentanyl overdoses in 2022. So that does make up a majority of it, just to give you some insight.
This slide is showing the morbidity and mortality data of fentanyl use in the San Joaquin County. So in 2022, 91 people from San Joaquin County died from fentanyl use, and 45 of these people were between the ages of 15 to 34. The year before, in 2021, 48 people from San Joaquin County died from fentanyl use. And with these statistics, the overdose death rate was 20 times higher in 2021 compared to 2018. More than half of these victims were between the ages of 14 and 35. So there is a trend of fentanyl deaths among young and young adults, making them the most at risk in San Joaquin County. We also have at the bottom of this slide the deaths, ED visits, hospitalizations, and prescriptions for opioids in San Joaquin County of 2021. This slide and the following slides show fentanyl-related overdose deaths and fentanyl-related ED visits in the San Joaquin County. Since 2018, there have been an increase of fentanyl-related overdose deaths and emergency visits. This graph indicates the rate of fentanyl-related overdose deaths in San Joaquin County by zip code. The darker areas show higher rates, and the lighter areas show lower rates. The area codes that are at highest risks of overdose deaths from fentanyl include 95237, 95204, and 95203. This slide contains a bar graph showing the fentanyl-related overdose deaths by age group in the year of 2022 in the San Joaquin County. And with this bar graph, you can see that the majority of victims who have died from fentanyl-related overdoses have been between the ages of 25 and 35. And then the bar graph is showing the highest age affected is between the age of 30 to 34.
It's important to address the fentanyl crisis through social determinants of health. Lower levels of income and poverty can affect health-related behaviors such as drug use. This chart shows the most common ethnic group and gender who live in poverty in San Joaquin County, and they are Hispanic females. Crime and safe housing are also factors. This chart shows crime grades in the San Joaquin County ranging from colors green, which means the area is safe, to orange, which means the area is high in crime. As you can see, most of San Joaquin County is covered in orange. This chart shows fentanyl-related overdoses by ethnic group. From 2017 to 2020, every ethnic group shown here more than tripled in fentanyl-related overdoses, with African Americans being the most impacted. Previous federal discussions and legislations have been about the prevention and treatment regarding the use of fentanyl, but now more focus has been placed on how to reduce the supply of fentanyl. Border control, international relations, and law enforcement have also been on the forefront of discussions.
Hello, I'm Jason. I'll be doing the analysis. So the fentanyl crisis came about because of the prescription opioid overdose in the early 90s. The potency of the street drugs has increased because of the users themselves have become accustomed to the opioids and need stronger and larger amounts to still obtain the same high. Many of these precursors and drugs are manufactured and sold in the United States from other countries. The synthetics are the drugs that have the most overdoses. California has the most fentanyl deaths, with San Joaquin County leading the nation. Social determinants of health of low income, African American, Native American, and ages 25 to 35 see the highest overdoses. Drug use increases crime rates because people are trying to pay for their drug habits. And the increase in deaths in 2019 to 2020 were because people were mixing synthetic opioids with other illegal drugs. This shows that the opioid crisis didn't just happen overnight. It's happened over many decades, and now we have to try to solve this problem. So you're probably asking, what can we do about this? Well, we need to prioritize our resources. We can educate people in schools, high schools, and colleges to recognize when someone's overdosing and how to properly administer Narcan, also making Narcan available in these school campuses. If we give law enforcement more funds, it can combat the fentanyl and trafficking online and abroad that are flooding our borders, and increase jail time for fentanyl dealers and suppliers. Also, we could require the insurance companies to cover the cost of Narcan distribution and making it more widely available. Currently, the Fentanyl Task Force has been established by Senate Bill 19.
Policies related to fentanyl. The Food and Drug Administration approved naloxone, the antidote for opioids like fentanyl, to be available over the counter. Code of Federal Regulation Title 42, Part 8 allowed for opioids to be used as treatment of opioid addiction. The SUPPORT Act, which stands for Substance Use Disorder Prevention that promotes Opioid Recovery and Treatment Act, was passed. And in 2018, the Fake Pills Amendment was enacted, which increases the sentencing for those who are convicted of giving false and deadly substances. There are some gaps in the policies, one being the SUPPORT Act that requires reauthorization each year due to funding. The last date it was renewed and extended was this past September. Another gap in policy is that not all insurance plans cover substance abuse treatments, and many of those treatments have eligibility requirements. So while this rehab program is beneficial, it is not accessible to all people.